Are nurses allowed to turn off sedation in order to wean patients off a ventilator, or do you need a doctor's order? Short answer is at most hospitals, there is a standing protocol for vented patients in order to allow nurses to start the weaning process off of a ventilator. You may have heard of spontaneous awakening screen, a spontaneous awakening trial, spontaneous breathing screen, or spontaneous breathing trials before. Essentially, what all that language means is it safe to wake our patients up, and is it safe to put them on a breathing trial? I know this is kind of blurry, but I'm going to just briefly walk through this. I also have a whole playlist on spontaneous awakening trials all the way up to spontaneous breathing trials, extubating patients. So if you want a more in-depth series, go check out that playlist. So every 24 hours, we are evaluating patients to see, are they ready to wake up? Are they ready to breathe on their own? And are they ready to extubate? So the first step is going to see, is your patient even appropriate to wake up? So here are some questions right here that would exclude a patient potentially from waking up. For example, they are on paralytics. They are receiving sedation for extreme agitation. They've had an MI in the last 24 hours. They have evidence of increased ICPs. Are they receiving medications for active seizures or alcohol withdrawal? If you answer yes to any of those questions, it may not be appropriate to wean your patient's sedation down, and you would go back to the beginning, start over in probably 24 hours, unless the patient's condition changes during your shift. If you answer no to all of those things, then we are going to see if we can potentially wake our patient up. This means you are going to turn their sedation off. Now, the technical way that it tells you to turn sedation off is to turn the patient's sedation off completely, leaving their pain medicine if they're on a continuous pain medication drip. If they are not awake in 2 hours, then you would cut their pain medicine in half. If they are not responding 2 hours after that, then you would shut their pain medication off. However, I always say spontaneous awakening trials are an art, not a science. If you have 90-year-old grandma that's on 5 mics of prop, sure, you could probably go ahead and shut that off. But if you have a young 18-year-old that just OD'd, that got intubated in the ER, and they are on a ton of medications because they have a high tolerance history to these medications, they're going to be pissed if you just completely turn all their sedation off. Personally, for me, weaning a patient's sedation off depends on the patient and the situation. Some patients I might go nice and slow. Some patients I might cut it in half. I might turn it off. It really just depends. I can make a video on this more in depth if you want. From there, we're going to see how our patient tolerates being awake. Can they follow commands? Can they stay nice and calm? Do they have any of these symptoms or things going on that potentially would exclude them from going on a spontaneous breathing trial? Okay, I hope that answers your question. I am totally happy to talk more about this because I know that this is a lot of information, but definitely check out my playlist because I've talked about this in depth, and I think that'd be a great place to start. But in short, yes, nurses can turn a patient's sedation off, typically without a doctor's everyday order, because we have standard